I'm Marissa Swanson. I'm a fourth year in the Medical Clinical Psychology doctoral program at UAB, and I am also doing a Master's of Science in Public Health and Outcomes Research through the Department of Healthcare Organization and Policy. My research really combines my interests in psychology and public health, so I focus on community-based interventions in international settings, and specifically for the past few years I've been focusing on ways of preventing unintentional childhood injury through the Youth Safety Lab at UAB. I was able to go back to Uganda, a country that's very near and dear to my heart, having spent 2 years there previously. But I went back in 2016 to deliver 2 classroom-based interventions. We used the Careful Cubs program to teach personal safety skills to first graders, and then the Super Siblings program to teach child supervision skills to 6th graders. What we found is that older siblings really do have a large part of the responsibility for caring for younger siblings, but they're not particularly good at it. About half of the kids in our study said that a child they had been supervising was rather seriously injured under their care in the past year. So we know that interventions are needed to kind of improve their ability to prevent some of those injuries, which is what we were looking at in the classroom, and I think we've made progress towards that goal. So like I mentioned, I worked in Uganda for 2 years before I came to UAB, and in the school that I was at, there were several children that were dealing with lifelong consequences of previous unintentional injuries. So one student had actually had a very severe scalding burn when he was an infant. He had crawled in a pot of boiling milk and had very significant scarring and some slight mobility issues from that. He was actually being supervised by a young adolescent when that happened. We also had another student at the school who was in an animal attack when he was younger and lost 2 of his limbs from that, which again I think probably could have been prevented with closer supervision. The Moses Sinkala Travel Scholarship really enabled me to complete my research project in Uganda. We were able to get a grant to cover the study expenses itself, but not the travel expenses to get to the country. So without the Moses Sinkala Scholarship, we wouldn't have been able to really carry out this research or make use of that grant. So it was really a rewarding experience, and I feel very grateful to have been able to do that very early on in my graduate career because it's kind of opened some doors moving forward. I recently applied for a Fulbright scholarship and I became a fellow in unintentional injury prevention through the CDC and the Society for Public Health Education, and I really think the Moses Sinkala Scholarship helped me achieve those.